Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. More than 11.7 million Americans suffer with chronic obstructive pulmonary disease, or COPD. West Virginia has one of the highest rates of COPD, with more than 186,000 West Virginians, or 13% of the state's adults, affected by this lung disease. What causes COPD, and why is there such a high rate in West Virginia? Who is most at risk of getting COPD, and how do you prevent it? Is there a cure? We'll answer those questions and more with Dr. Rachel Leonard, a WVU Medicine pulmonologist and critical care medicine specialist. Welcome, Dr. Leonard, to Live Healthy West Virginia.
Thank you so much for having me. It's such a pleasure to be here.
It's great to have you here. So let's start with the basics. First, tell me, what exactly is COPD?
Yeah, so COPD, as it says in the name, is a chronic disease of the lungs, which is characterized by obstruction. So when a patient or a person exhales, the airways narrow and that limits the airflow coming out of the lungs. At rest, this may not cause a lot of symptoms, but usually with exercise, as the disease gets worse, people will get more short of breath.
Okay. Well, what causes it?
The most common cause is unfortunately smoking. There are a lot of other causes that can contribute, some developmental diseases or delays. So if you were born premature, that puts you at risk for having just underdeveloped lungs and puts you at risk for developing the disease perhaps a little bit earlier. There are some genetic causes. And we also know occupational exposure plays a big role in it, certainly with a lot of the coal miners that we have in West Virginia as well.
Oh, yeah. When do you usually develop the disease? Around what age?
Most people develop it in their 50s to 60s. So you can smoke for a long time. We're born with a lot of extra lung reserve. So you can smoke for a long time before you really start to develop symptoms.
Okay. So I know you kind of half answered this already, but why is COPD so common in West Virginia? You mentioned coal mining and smoking. Mm-hmm. So that's my guess.
Yeah. So COPD is more common if you have more than one reason to develop it. So a lot of our patients are smokers and were coal miners or had other occupational exposures. So anything that you're exposed to a lot of dust or have things that cause airway inflammation in your job certainly can increase your risk of developing it. Also, air quality is a big part of it. So if you grew up in an urban area and you had poor air quality, or you have asthma that's really uncontrolled. So there are a lot of different factors that go into it, and a lot of people have more than one.
Okay, good to know. So who is most at risk then of getting COPD?
Yeah, people who are most at risk are those who have smoked for most of their life. Unfortunately, people in West Virginia who I've met started at the age of 13 because that's really what everyone else around them was doing. So they've smoked for a long time, and it's really a hard habit to quit. That's who's most at risk, but we certainly see a lot of other people, coal miners and others who develop COPD even without smoking.
So you can be a non-smoker and still get COPD.
Correct. It's a lot rarer, but it still is possible.
Okay. Is there a cure?
Unfortunately, there's not a cure. When COPD gets really advanced, patients will qualify for lung transplant, which does help with symptoms, but is not a perfect fix, unfortunately.
Okay. All right. So let's talk a little bit about the symptoms of COPD. How do we know if we're developing COPD?
Yeah, most people will have shortness of breath, particularly with exertion or getting around exercise. Other people will complain of a chronic cough. Oftentimes that's productive, where they'll cough up mucus in the mornings. And those tend to be the first few symptoms that people will develop.
Okay. So what are the complications of COPD if it goes untreated?
Yeah, so COPD, the biggest complication is just worsening symptoms, more shortness of breath getting around. A lot of people develop disability as a result of that, so inability to really do the activities that they really want to keep doing. Other complications can include a collapsed lung or a pneumothorax. That can happen when people have emphysema type COPD. Otherwise, you can also develop lots of other things like low oxygen levels. And you can develop heart problems as a result of that. It's called pulmonary hypertension. So there are a lot of other things that we worry about. People who also develop COPD are at risk of things like lung cancer too.
You mentioned emphysema. So there are different types of COPD.
Correct.
Tell me, what is emphysema?
So emphysema is actually damage of the lung tissue itself. And it forms essentially these big areas of air within the lung that can contribute to the breathlessness that people have.
Is that one of the more common kinds of COPD?
I would say that it's just a different type of COPD. We've learned a lot that there are different, what we call phenotypes or subgroups of COPD.
Mm-hmm.
There's a lot of overlap between them. So you may have one, you may have the other, or a combination of both.
Oh, wow.
So one is called chronic bronchitis. This tends to be a person who coughs more, has more airway inflammation, where emphysema is more of this airway destruction or alveolar destruction.
Okay. So how do you go about diagnosing COPD? The symptoms seem kind of obvious.
Yeah, but a lot of things can cause those types of symptoms. So certainly even just asthma that's not well controlled can cause shortness of breath and a cough.
Sure.
So the best way to diagnose it is what's called spirometry, or a breathing test that's done by our respiratory therapists. They have you blow forcefully, and if the airways kind of narrow during that, is diagnostic of COPD.
Okay. All right. So how do you treat COPD?
Yeah, COPD treatment is pretty broad. The best treatment we have is inhalers. That's really what we start out with first. So a long-acting inhaler can decrease the symptoms of COPD as well as decrease how often somebody gets a flare-up. And so flare-ups are really important to decrease. They can actually accelerate or increase the lung loss or progression of COPD over time. So we really want to decrease those.
I see a lot of commercials on TV for COPD medications, and it looks like you mentioned, there's no cure, but these medications can help manage it, make it, I guess, more livable, for lack of a better, word.
Correct.
Mm-hmm.
They help control the inflammation. And they're also a class of drugs called bronchodilators, which essentially just means to open up the airway. So it can help with that sense of shortness of breath when people are getting around.
Are these newer and more effective, or am I just, watching too much TV?
I would say that a lot of the medications haven't changed from an inhaler perspective, but we have changed the ways that we're able to give them. Instead of having different inhalers for all the different kinds, there are 3 types of medicines we usually want people on. They actually have combination inhalers now, so it's all 3 medicines in one. So it's a little bit more convenient for people.
Sure. So is there hope? Is there hope for people? If I get a COPD diagnosis, should I be cautiously optimistic?
I think so. I think there are a lot of newer medicines out there to help manage and decrease the symptom burden, as well as to help the exacerbations to avoid progression of the disease.
That's good to know. So there's more than one way to treat COPD, isn't there? How do you individualize COPD therapy?
Yeah, what we're learning with a lot of the newer medicines that are coming out is that there are, even within chronic bronchitis, for example, there are certain phenotypes or different types of patients.
What do you mean by phenotype?
Phenotype is just a name for a different grouping of people. So the underlying reason for why they're having problems is different. Mm-hmm. So when we see somebody, we want to see, do they have more of this chronic bronchitis or do they have emphysema? And then if they have chronic bronchitis, what's driving that inflammation? And so there are newer medicines that if you have a type of inflammation called eosinophilia, a type of white blood cells that is associated with allergy and inflammation, if you have that and we target it, your symptoms can actually improve.
Oh, that's great. Are there surgical options for treating COPD?
Yeah, so if you have emphysema, surgical options definitely exist. Dr. Hyanga with our thoracic surgery department, he is a transplant fellowship trained surgeon, and he does surgical lung volume reduction. And so this is when they go in and they remove the diseased part of the lung, which lets the better part of the lung work better.
Okay, so you can remove the disease part and still have enough left to function.
Correct.
And Dr. Hyenga's great.
He's wonderful.
He really is. We're lucky to have him here. What about non-surgical options for treating COPD?
Yeah, there's a newer non-surgical option that got approval back in 2018 and which is starting to really become more available. We started our program here 2 years ago. It's called endobronchial valves. So this is a one-way valve that's put within the airway through just a regular bronchoscope, no surgical incisions, and can have pretty similar outcomes in the right patient population compared to surgery.
So you're able to put it in the lungs, and it just helps you breathe easier, or it helps keep the airways open?
So it helps to, in the same way that surgery removes the lung, it actually helps to deflate the bad part of the lung to let the good part work better.
Oh, wow. That's interesting. All right. So what's the best way to prevent COPD? I bet I know the answer to this.
The best way to prevent it is to quit smoking as early and as soon as you can, or to never pick it up in the first place. So to tell our kids to not smoke. We have still a pretty big teenage population in West Virginia that smokes, unfortunately. So to get them to not start smoking or to quit smoking when they're young is also really important. But for all of our adults too, that even if they have mild COPD and they quit smoking now, it helps to prevent progression of the disease.
Does vaping count? I think a lot of people think vaping is harmless.
Yeah. Unfortunately, vaping also causes a lot of airway inflammation. We don't have as much data about vaping long term. We're still looking at that to see, do these people develop COPD down the road? We don't know, because it can take 20 to 30 years of constant smoking to develop COPD. And vaping hasn't been around that long yet.
No. All right. Well, I wanted you to talk a little bit about the level of expertise of the COPD team at WVU Medicine.
Yeah, our COPD team is excellent. I've been spearheading a lot of the progress that we've made. I started our endobronchial valve clinic 2 years ago, but I've been here for over a decade and have been providing COPD care for our patients. We've recently brought on Dr. Potla, who's going to be running our advanced airway disease clinic. So he'll be seeing advanced COPD and advanced asthma. And then, of course, we have Dr. Hyenga, who is an integral part of our COPD team as well, who has decades of experience.
Is it ever too late to start treatment for COPD? You know how people are afraid, I don't want to go, I don't want them to find something, and they wait a little longer. I mean, is it ever too late to start?
Never too late. I see people who have had symptoms for such a long time and have really avoided going to see doctors. And once they come and they get started on the right treatment, are amazed at how much better they feel.
And they wish they'd have done it sooner.
Yeah.
Huh? Yeah. So before we go, what's the most important thing you want our viewers or listeners to know about COPD?
I think the biggest thing is that it's preventable, that if we quit smoking earlier, that we can prevent COPD from happening or prevent progression of it. But if you have COPD, there are treatment options for you, and we'd love to see you.
All right. Well, thank you so much, Dr. Leonard, for sharing all this information with us. We hope a lot of people pick up on this and put the cigarettes down.
Thank you so much for having me.
It was great having you. So that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about COPD and other lung diseases, visit wvumedicine.org. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or the Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Leonard and everyone at WVU Medicine, thanks for joining us.